Good morning. Welcome back, everyone. Just about 15 minutes before 7 outside right now, about 36 degrees. Well, a lot of patients worry when they see their hands tremble that they might have Parkinson's disease, when it's often actually called by something called essential tremors. This morning, we're joined by Gundersen Lutheran physician Jason Aldred to tell us more about the symptoms of essential tremors and what we can do if we see them. Good morning, Dr. Aldred. Thank you so much for coming or joining us today.
Good morning.
This is something that I had never heard of before. Can you tell us a little bit more about exactly what essential tremors are, why it happens, and what it looks like?
Sure. Well, tremor is not altogether uncommon. People will sometimes drink too much coffee and see some tremor, but this is really different. When tremor is present most of the time, particularly during the day when people are awake and when they're using their hands, doing things like eating, drinking, doing things that work with tools, and their hands begin to shake, and it's a persistent problem, then that most likely is caused by something called essential tremor. And really, it's been underappreciated for a long time. And for many years and years, it was called benign essential tremor, meaning that there really wasn't any association with other problems like Parkinson's disease. But what we found is that's not really the case, that the tremor can be actually very disabling sometimes, even though it's not associated with Parkinson's disease. Just the fact of having a tremor that can become very severe can really keep people from doing things that they need to do at work, and also from interfering with just doing basic things throughout the day.
And why do these happen?
Well, it's still not really clear. There's definitely some type of hereditary component there that runs in the family. In maybe half the cases or more, you'll see that parents have a tremor. One parent will have a tremor, and then maybe half of the children will have a tremor. But in some cases, that's not actually the case. So we're not really sure, but there is some type of a genetic link, it seems.
So how do you know the difference between an essential tremor and maybe an early sign of Parkinson's disease?
That's a great question. Well, in Parkinson's disease, the tremor doesn't always appear when the hands are being used for something. In fact, in Parkinson's, the tremor often goes away, particularly early on. Essential tremor, the tremor is usually much worse when someone's using the hands, or even in the voice, when someone's singing in church, or if the head begins to shake. Those are all signs of essential tremor, and that's very different than what we see in Parkinson's disease.
Either way, if you have a fear of Parkinson's or you think it is an essential tremor, is it time to pick up the phone and call your doc?
Well, I would say it's definitely time to ask for help if the tremor interferes with doing things in your daily life. Not all of these tremors need treatment, but sometimes just knowing exactly what's going on is the first step.
But they can be treated in some cases.
That's right. Half of the cases of essential tremor respond very well to medication treatment, and then for cases that don't respond well to medication, certain surgeries like deep brain stimulation can be used and are very, very effective for the right patients. So
the bottom line in here is don't worry too much. I mean, it is, time to call your doc, but don't think of the worst, that you've had Parkinson's disease. You do need to go in and have it evaluated.
That's right. Get more information. That's the bottom line for patients, is that go seek a medical help if you notice a tremor that's interfering with your life and the things that you're trying to do, and get more information, and then from there you can make the best decision.
All right. Dr. Aldred, thank you so much for joining us this morning. Essential tremors, something maybe to look into if you're having a little trouble. Thanks so much.
Thank you.
All right. I had never heard of that until this morning.